guys, it's Kristen. Welcome back to my channel. If you are new here, I am a second year Doctorate of Physical Therapy student at Mercer University in Atlanta, Georgia, and I film videos on my channel all about my PT school journey. So if you are new, you should totally take a second and subscribe down below. So if you are a subscriber of my channel, you know that I typically film like week in my life and day in my life vlogs, but I currently am on Thanksgiving break, so I thought this would be a good week to do a Q&A because I've been getting a ton of questions from you guys recently in my comments and on Instagram, and I also asked for some questions as well on my community tab. So I've been compiling a list of questions on my phone, and I thought I would answer those for you guys today. So without further ado, let's get into the video. So the first question is, I took anatomy in undergrad. Why do I need to take it again in physical therapy school, and what is the difference? So pretty much in undergrad anatomy, you kind of just learn the basics of anatomy. And then in physical therapy school, you kind of go through again body part by body part, learning more in depth the function, nerve, origin, insertion of certain muscles, and then specifically kind of how it presents to physical therapy. So learning about like common like patient presentations and diagnoses and stuff that relates to the anatomy, if that makes sense. So basically it's just like more in depth, more specifically directly related to physical therapy. So yeah, that's the difference. The next question is, in one of your vlogs, you mentioned being interested in women's health PT. Can you talk more about that and how to get involved with that as a student? So yes, I am interested in going into pelvic floor physical therapy, and I actually was super lucky and I was able to shadow a pelvic floor PT in college because one of my mom's friends is a pelvic floor PT, but unfortunately, it is really hard to shadow just because it is such like a personal thing. So if you are interested, I would tell either like your advisor or director of clinical education, tell someone in your staff that you are interested, and they can work with you and kind of tell you different opportunities that are available and kind of try to connect you that way. So I guess I can talk a little bit about my school in particular, but we do short-term clinical rotations, and that was this semester, and 2 times we got to go to a specialty site. So some people went to neuro, sports, pediatrics, and I and a few of my classmates that were also interested in pelvic floor were able to go to a pelvic floor clinic. So I was able to get more experience there. And then my school also has some contracts for full-time 12-week clinicals at the end of the program, which you can do in a specialty site as well. But most of those clinics, in order to take a long-term student for 12 weeks, they require you to take the pelvic floor level 1 course, which you can either take through Herman and Wallace or the APTA. I've heard both are great. I actually just signed up for my Herman and Wallace course in August, which I am so freaking excited about, and I just chose that one because the date and the location was most convenient for me. But I'm so excited, and I definitely will be telling y'all all about that journey and how that goes. But in that course, you basically learn more about pelvic floor and how to treat that population in particular, because that's not something you learn in school. So if you have any more questions about pelvic floor PT, please DM me. I would love to chat with you guys about that. But in general, that's just kind of a quick overview about it. Next question is, I'm starting PT school next year, and from your social media, it looks like you still have time to have fun with friends, family, and your boyfriend. How do you balance it all with school? I don't want to not have a life for 3 years. Thank you for this comment. This makes me so happy. But I do want to say that everything is not as it seems, and a lot of times I feel like I don't have a life. I do my best to balance it all. I do my best to schedule and plan my time and schedule in fun things. But I have talked about this in vlogs before, but it's just important to block out your time and set a cutoff time, because there truly is so much material in PT school. You could just keep studying and studying and studying and studying, especially if it's like the weekend and you don't really have anything like planned. So for example, I'll say like I'm going to study from 1 to 5, and then I'm going to get dinner and hang out with my boyfriend. So really just like kind of setting like work hours and end hours. And obviously if you have like a test the next day and you don't feel prepared or something, you might have to be flexible and adjust things, but it really is all about time management and realizing that you need to have some fun and you need a break, or else you probably won't make it through with your sanity. Sorry if you just heard my bird screaming. I'm home in Pennsylvania right now for Thanksgiving, and I have a pet parrot. A little bit of a fun fact, but he's being crazy right now, so sorry. But yeah, just knowing that school isn't everything, setting end times, making time for fun. You can do it. I believe in you. Next question is, how do you prepare for competencies? I always get so nervous. So I usually try to start preparing like about a week or so in advance, just because I do get really nervous, and if I start preparing kind of the day before or 2 days before, my anxiety just goes through the roof. But I usually go on campus with a friend or a couple of friends, and we will just run through either the skills that are in the competency, or sometimes our professor will post practice cases if it's more of like a case-based sort of competency, but just going through and speaking to my friend and my partner as if they were a real patient, and not just kind of chit-chatting as we practice the skills, but really in full Kristen PT mode speaking, because honestly, it's not the skills that are hard, it is the communication aspect of that. So just kind of getting your professionalism down and your words down, as well as the skills down. But I definitely do get nervous as well, and I don't think that's something that's ever going to go away for me personally. I think being nervous means that you care and you want to do super well, so it's not necessarily a bad thing. I think it makes you work harder in a way, but just don't let your nerves overtake you. Try to be confident. You're in class 6, 7, 8 hours a day practicing these skills. You know how to do them, so yeah, just be confident. The next question is, how do you transition to taking case-based exams? So I feel like my school did a really good job of kind of gradually making the tests more case-based. Like I feel like first semester there was only like a few questions on each test that were case-based, and then slowly it's like all of them are case-based. And honestly, I kind of prefer them. Like for example, my musculoskeletal class this semester, they're entirely case-based, so the questions will be like, a patient complains with this and presents with this, like what might their diagnosis be? And I kind of like that better, because usually there's like a few different hints in the question that point you to the answer, as opposed to a question that's just like, what are the nerve roots of the superficial fibular nerve, for example. So I honestly like them better, but in my recent video, I posted an entire video about my updated study routine for musculoskeletal, and I kind of go into detail how I prepare for a case-based exam, and that's way too much to talk about in this video, so go watch that video if you haven't already. The next question is super cute, and it says, are you doing well? P.S. Love your channel. Love you too. And yes, I would say overall I am doing pretty well. Last week was super stressful because it was the week before Thanksgiving, so we had 2 exams, we had 2 neuro competencies, we had a project due, so that was pretty stressful. But overall in general, I would say this semester has been a lot more manageable than previous semesters, so I am doing pretty well, and I'm happy to be home with my family for the holidays. The next question is, how do I prepare for my PT interview? And again, I have a whole video about this on my channel, which I will link in a card, but in summary, I would just say really know what makes that program unique compared to other programs. Talk about that in the interview, ask some thoughtful questions that might make you a more memorable candidate, and really just show your personality, because PTs have a lot of personality, so you don't want to come across as a robot. You want to show them your heart and why you love the profession, so that would be my biggest tip. The next question is, can you talk more about your clinicals? How's that going for you so far, and what all do you do? So this semester I was at outpatient ortho and also pelvic floor twice, like I mentioned earlier, and basically you're paired one-on-one with the clinical instructor, so I'm just her little assistant for the day. And at the beginning of the day, we usually have about like 10 or 15 minutes, so she'll kind of go through and look at all the patients she has coming in. Usually it's like patients that I've already seen the last time, so I kind of will know about them already, but if there's anyone new, she'll kind of give me the rundown, or if it's an initial eval, we'll read the forms that they've submitted and stuff, and then before the session, before the patient comes in, she'll kind of be like, would you feel comfortable doing XYZ with this patient? And I would say yes or no. So that's pretty much what we've been doing. I really got lucky this semester, and all of my CIs were awesome, and I was able to learn a lot. And I liked how they weren't just kind of putting me on the spot, like while the patient was there, being like, okay, do this with them. I kind of had time to prepare and think, and that really helped my confidence. So if you are starting clinicals, I would kind of consider how you work best and communicate that with your CI. Next question, what is a better pre-PT major, psych or exercise science? So there are people in my class that are both majors. I would say exercise science is definitely more common, and you learn more about anatomy and like exercise physiology. So that kind of gives you a leg up in those classes before PT school, but the people that took psychology are still doing great. So I would just say whichever one you think you could do better in college, whatever is more interesting to you. I don't think one's necessarily like better than the other, if that makes sense. They both will get you into PT school. Sorry, my camera just died. If I'm at a little bit of a different angle, that is why. But the next question is, when do you graduate? So I will graduate in May 2023, and after this Thanksgiving break, I just have 2 weeks of classes and then finals, and then I have my spring semester of classes, and that's my last like didactic semester, and then the last 3 semesters, so summer, fall, and then spring again, are full-time clinicals. So I'm almost done the academic portion, which is honestly crazy, and it flew by, and I can't believe I've been vlogging for all of this. So wow, wild. I think those are all the questions I'm going to answer, but thank you guys so much for watching this video, and please be sure to give it a thumbs up if you enjoyed and subscribe down below because I post new videos every single Saturday, and I'd love to have you here for my physical therapy journey. And if you have any more questions, you can also leave those down below. I will talk to you guys in my next video next week. Bye, friends!